Hello, my name is Casey with Beyond Limits Physical Therapy. I want to take this opportunity to talk to you a little bit today about blood flow restriction training, or BFR training, and how we implement that in the clinic here at Beyond Limits Physical Therapy. Before I get into that a little bit, I want to talk a little bit about exercise and strength training specifically. Strength training is when you are working against a certain load to stress your muscle so that you can increase your strength or increase the size of your muscle, which is called hypertrophy. When you do that, you put your muscle through a little bit of an environment where it doesn't have enough oxygen, so then it has to work to be able to attain those things, and creates a series of physiological events that result in that strength training or that strengthening, as well as those muscle gains. With blood flow restriction training, what that does is you take like a blood pressure type cuff, and you put it around the limb above where you want to exercise, the muscle you want to exercise, and it occludes a portion of the blood flow of that area. And what that does is that makes the muscle feel like it's working harder than it actually is. And it creates a little bit more of that hypoxic environment, or not as much oxygen to the muscle. And what it does is it allows your body to feel like it's working harder with less loads. So for example, if you're doing an exercise with a certain amount of weight on a curl or something like that, if you do less weight, it makes the muscle feel like it's actually lifting higher levels. And the reason that's good is it allows us as physical therapists to help build this hypertrophy and have these strength gains in certain patients that may have a lot of pain when they exercise a certain joint, or if they've had surgery and protocol doesn't allow them to put as much load through that joint as it's healing. And so it's good in the initial phases of therapy, or when there's pain, to allow for those strength gains to happen. Now, this isn't the most ideal way to strengthen all the time, because ultimately we need to live and be able to tolerate the loads that our joints have from the day-to-day activities. But it's very effective in the beginning stages of physical therapy, or when pain is a significant impairment that we're trying to work through. So I take this moment to demonstrate to you a little bit about blood flow restriction training. All right, so here is an example of what one of the cuffs looks like. This goes around whichever limb you're going to use. So for our aid here, we're going to put it on her right leg, as, for example, she has had knee surgery on her right leg. They come in different sizes based on what limb you're doing, upper extremity, lower extremity. And then you strap it around nice and tight like I have here. And the nice thing about this tool that we have is it calculates the limb occlusion pressure for us, or how many millimeters of mercury does it take to shut off all the blood flow to the leg. And then it calculates a percentage that we want to exercise at. Obviously, we're not going to exercise at the full limb occlusion pressure, but a certain percent. So for the lower extremity, we do kind of 60 to 80%. So before I started, I calculated that, or turned it on, and it calculated that 70% of her limb occlusion pressure is 105 millimeters of mercury. So then I have this instrument here that I plug it in. I put in the 105 millimeters of mercury, and that'll count up for us. And then after it's done counting, I'll remove the tubing from it, and then she'll be able to perform her exercise. And again, what this does is she's going to do some straight leg raises, and her muscles are going to work as if she were lifting a lot more weight around her knee. But what it'll do is it'll allow her knee to not hurt, or not put too much load through the knee as she tries to do that strengthening exercise. So I got to the 105 there. So I'm going to go ahead and lift this off here. All right. Okay, go ahead and do 10 straight leg raises for me. Perfect. So this is blood flow restriction training, something we're really excited about to do in the clinic. If you have any questions or anything, feel free to give us a call here at Beyond Limits.